You may want to consult with other people. I just want you to know, and by the way, that Herald story was put in the paper by me by disclosing to them everything that we had. So I don't even know what it says, because once you give it to the Herald, I'll leave that nameless after that. But the Herald does whatever the Herald's going to do with it. I gave them as much information as we had when we had it. It doesn't matter.
Was it based on some type of request though from other information that they had that they came to you about and said we're going to put this in the paper and therefore?
The Herald knew nothing about this.
Okay.
The Herald knew nothing about it.
Over here, can I ask a question?
I have a quick question.
My daughter has been playing in this park since she was, before any slide got put on, while we were still bubbling up glass. Am I going to have to get her tested for lead and arsenic?
So that's my question. What would you? I was going to follow up.
He was about to answer. Does he have respiratory?
The procedure that we follow to answer that question is, with all the data I said before, we already refer to the Department of Health.
Okay.
That's why this has to be a multi-agency effort. So we determine immediate action. Your question, we know, we expected, we had those questions at other sites. So those answers will come from the Department of Health. But remember, we are here. I understand. We refer all the information, the sample results from this specific park, in addition to the area-wide, to the Department of Health. They have 2 toxicologists assigned to this case, working with Dr. Samir Elmir, who is here with me, evaluating the data. It's very early on that stage. However, we took actions because we didn't want to wait. And to answer your question, the orders to the City of Miami to implement the actions, it was a letter that we signed September 4th. So it's September 4th, before the article.
But that lady's question is good. You couldn't give respectfully, you can't say no, that we shouldn't have our kids tested for that stuff, right? Because you guys don't know the answer yet.
Well,
that's concerning.
Maybe an easier question. What would we ask the doctor to test the children for?
Until
the chemical,
until the results come back.
Remember,
I think that makes sense, right?
it does. It's a sophisticated process, but let me explain in simple terms. You have a lead concentration that requires us to provide action. The Department of Health will look at the data to determine, for example, if this action was appropriate and needed. Second, one of the questions that they answer is, do the kids need to be sampled? So they will answer that question, but it's not automatically related to a concentration because they have other techniques to evaluate that. What we urge you, we will provide you the contact information from the Department of Health so you can actually ask that specific question. But they do have the results.
One last question, Mr. Mayorga.
For them to make that evaluation.
What's that?
The time frame before they tell
I'll be
us.
brutally honest. There was a bowl of sand that was probably like a foot or 2 deep over in that corner that all the kids used to dig in and eat. So that would be, as one of those kids' parents, my son didn't eat it, but those kids' parents, I'd be concerned. And I'd want to go tomorrow, not 2 weeks from now or 3 weeks from now. I mean, it's already been a little bit delayed. So what could we ask, you know, the Department of Health, or what could you find out for those parents?
We got a doctor right here.
Okay.
Well, what would you recommend? Because fortunately it wasn't my...
I'm sorry, let me simplify that. If it was your child and you decided, like she sounds like she's deciding to take them in to get tested tomorrow, what would the question be to the physician? How would you pose the question?
Okay, first of all, thank you for inviting us to this very important meeting. My name is Samir Elmir. I'm the Director of Environmental Health and Engineering within the Miami-Dade County Health Department. I am not a physician. I have a doctorate in environmental engineering. So, but like Mr. Wilbur Mayorga explained the process, we became aware of the situation a couple of weeks back. Durham has already approved the sampling plan, the regional plan, and also where the site, where the incinerator was. And they sent us the first set of samples the last week of August, which we started looking at it. We have 2 toxicologists working on this, but they didn't sample this capped area. They sampled only the area where you have sand, uncapped. Okay. Now, from the initial set of data, what we have, really most of the high levels of heavy metals that they found is below the 6 inches. Actually, in terms of public health, if you want to assess exposure, you need to have certain factors exist. They have to exist together. Basically, you need to have the chemical, you need to have the concentration, and you need to have the exposure. And how often the kids or the adults, frequented this park.
Some kids eat it every day.
I understand. Let me tell you something. I've been living in this community for 23 years. My daughter, she's 26 years old. I used to bring her to this park and to Peacock Parks and all these parks. I feel your concern.
Well, I'm more concerned about it. My son never ate it. He didn't want to get dirty. But
so what I'm saying, it depends on. So what I'm trying to say that based on the data we get, most of the concentrations found, they're below 6 inches, but that's initial sampling. Below 6 inches, meaning the potential for exposure is very minimum.
right now,
Right?
Is that what you're saying?
No, I'm not talking about the capped
Before they
area.
capped it, it
the
was...
capped area, I don't know about the level of concentration with chemicals and so on and so
You're
forth.
saying 6 inches below the uncapped
The area that was
The uncapped area.
the uncapped area.
There were 9 samples taken of the top
Right.
6 inches around the perimeter, and that
And
came
only
back.
one of them, I think.
Okay, so nothing was sampled inside the park.
Yeah.
Correct.
Okay.
That's what, sorry, I think that's something all the parents here, a sample must be taken where the sand was.
I can
so
tell you
that we
Well,
know
this is
when
the
our kids were
this
exposed,
is well
because
this
it
is
was
this is
much farther below where this is.
Thank you so much. This is the benefit of this meeting, is to work together to give us some feedback about the frequency, who visited the park, for how long, what was the condition of the park before the capping. So I think if it's necessary, I will ask Durham here to take a couple of samples, random samples, underneath the cap to see what's the condition of the soil, and we'll be more than happy to look at them.
In that inside area, that's where the sand was.
I
was
suggest,
much lower than the rest of
you're
the park.
asking excellent question. I suggest you talk to Mr. Give her your phone number and make these suggestions, and I recommend that we collect some spot samples and we will evaluate them for you.
Can I have the
One last question, Mr. Mayorga.
before that? I just need one favor from the two of you. After the meeting is finished, can you show me the location?
Absolutely.
Thank you.
Thank you so much.
And number two, remember that we collected a sample between the two parks where we will have that vertical profile as a further indication.
Okay.
We did have some 0 to 6 in this area that have concerns. So it's not only the 6 to 24 inches or 6 to 12 inches. So
Yeah, we
what,
definitely
how,
below that.
what we focus on the current and open area. To address historical exposure, we determined what was the depth when they did that work. So we know to what depth we have to go below to collect a sample that is representative of this park at that time.
Right.
We will get those results and then they will be evaluated.
And we will evaluate it.
Okay.
Let me tell you, Durham is, they have, I've been working with them for more than 20 years, especially with Mr. Mayorga and his staff. I'm not saying this because he's my colleague, but I can tell you that he will do the best in every case, because he's done a couple of incinerator cases before. I worked with him on them, one on 20th Street next to Jackson and one in Coral Gables. He will do his best to have the best sampling plan for you, to get us the data necessary so we can do the toxicology analysis and get back with you with the results.
But I think in the meantime, I think probably what parents would want to know is what were the metals, so if they go to the doctor tomorrow, they can say, okay, it was this percentage of lead,
I'm going to give you my business card. We have a table with every chemical that was above, and we can provide that to you.
I think that's what parents would want to know, because then they can go to whoever they want to tomorrow and not 2 weeks and say, can you test my blood? Can you test?
Sure. Let me answer this question. My answer is going to be very general based on many years of experience working on this. Unless we get the actual data representative of the condition, we won't be able to give you the best recommendations to follow. However, taken today, if I take my daughter today to do hair or blood or urine samples to look for those heavy metals, even if they find them, there is no tool or assessment tool to tell you how much she's been exposed to and for how long and from where. So you can find it, but
Okay, but if you, I mean,
now if you decide,
but if you have a 4-year-old
if you're really concerned,
2 years, you
right,
can almost kind of come up with a general.
if you're really concerned, you could at any time consult your physician, and I'm sure they will give you, he or she will give you the best recommendation.
You've had your hand up forever. Go ahead.
Just with regard to the dog park, you tested the bushes around, but did you test in the mulch area? That's not capped?
I have the sampling locations with me, so if you want after the meeting, we can walk and you show me.
But you're waiting on the results for that?
No, we received initial sample results, then we conducted additional samples that we're waiting for sample results.
Okay.
There was an initial sampling done by the city that included some of the areas within the dog park area.
How can we get you in contact?
For the public? Yes.
He'll give you the
But for,
Sure.
do you not use tap the...
Lee, can you?
You can call Durham and ask for Wilbur North. 305.
In other words, 0 to 6 inches for the dog park has come back clean. Now we go deeper, we don't know what we're going to find. Now bear in mind what happened at the dog park. You added 3 to 4 feet of fill, and the fill is now, and you evacuated about 4 inches of dirt.
You can call Durham.
So remember, even here there was an evacuation process, and then you added. In the dog park, there's a great deal of addition, especially on the mounding. I don't know if everything got mounded, but most things did get mounded.
And that's what we're going to, the information that we need to analyze is those elevations, so we can determine at what elevation we need to sample to answer the historical perspective.
When do you anticipate that all of these reports will be up and available to the public? Because the Durham Public Records website today was disabled. It was unable to be seen by anyone. So I was just wondering when these reports are actually going to be available.
We update those regularly, so the report of the sample results that we just received will be available within a couple of days maximum. So, and with your information, tomorrow I will make sure that they are posted.
What question was used when removing the soil?
Let me just answer her question.
We don't want an airborne.
One second.
4 years ago, my daughter was 1 year old. And we're probably like 6 or 7 family comes here, and there's the sand. We dig like food because we build sandcastles.
Of course.
We found old glasses, garbage, plastic, anything that is garbage. Once we touch those stuff, we throw them out because glass, but it's an old glass. So I know that it's garbage. Are we exposed? Or my child exposed?
What we're going to do to answer that question, at that location, we're going to go at depth to that same interval. So we can provide an actual concentration, an actual analytical to Samir's team so they can answer that question. But that's exactly what we need to find out.
Was any testing done before the park was built? Is that not a standard thing to test before you build
I don't believe the city did test the park before it was developed. And remember, that was in...
I mean, if we were doing a project at a site that was a known site, like the old incinerator site, that is the normal course. This wasn't on anybody's books.
When I moved here in 1987, this was a park.
We've been researching records as of, over the last few days, and it seems that the park was created in 1962. That's when it was started to be used as a park.
The process when now, after the regulations were enacted from EPA, because remember, when this park was developed, when the incinerator was operating, Durham did not exist. Durham did not exist when these things occurred. We did not have permit requirements. So when a park construction comes to us and we have a dump site, they are required to do this sampling. And there are standards published by the American Society of Testing Materials to do that.
Oh shit. I have another question. What if our child is something tested, that it's something going on, who do we contact?
Department of Health. They will be the first to answer those questions. What we're going to do is sample at the depths. So please stay with me at the end of the meeting because I want to see that location.
That's the center of the
The
park.
former area where you had the sand box.
Oh, no, there's no sand. That's the whole area, the center.
Wherever you see astroturf, there was sand.
Yeah,
It was sand
all
before.
sand. Yeah,
Okay.
it's all sand.
So we can do a grid sampling to evaluate them that day.
Wilbur, there's a lady.
About our homes, like, did you say anything about whether we should be concerned about the dirt and the soil
The
in our
homes associated,
homes?
the soil sampling at the edge of that we conducted will answer that question. Our staff, when they move away, they do not see the same soil away. So that's a good indicator, but we need the sample results to answer with facts that question.
All right. So,
Oh, yeah, one more thing.
Yeah, it was.
When the soil was removed here, you know you have to be careful that you don't, none of the carcinogens go airborne. What precaution was taken so that that did not happen?
Well, no, because nobody knew at that time that there was any kind of soil contamination. So whatever was done to cap this, that's what he's talking about. Remember when we capped this? We treated this like it was a park.
So it could have gone airborne and you didn't know.
Now, and you're missing the point. None of the stuff, heavy metals don't go airborne. You're missing the point.
But heavy metals are not the only toxic agents in the soil. Am I correct? Am I correct?
Your concern is valid. Let me explain it further.
Yes, it is.
There is an element of volatilization that I explained.
That's correct.
But the issue that we're handling, and I answer that question to one, is the dust formation. And obviously, if you generate dust, the lead, if you have lead, is associated with a particle. So that's what we want to eliminate. So I cannot answer to you historically what they did. What I can tell you is our final closure of this park will be fully protected of the citizens that use this park. That I can assure you.
So you would recommend the park be continued to be used?
At this moment, we took action with the soil sample that requires action to be taken. We are conducting additional testings and we're working with the Department of Health to answer that question.
I'm concerned about the children. Are your recommendations saying it's all right for the children to continue using this park while you're doing the testing?
At this time, we did not receive any requirement from the Department of Health to close the park. To expand on that, we report the information. We need the Department of Health to make a decision to shut down the park. There are some levels, at another park we had 90,000 milligrams per kilogram that it was obvious that we needed to take actions and we closed a park. That's a different park. No, that's Olinda. That's a different park. And it's actually clean.
Let me answer.
So the levels here are lower, but requires the Department of Health to evaluate. She's been very patient.
Can you give us an idea of like what level we're talking about? Because saying things like highly contaminated or
no, I can tell you. I can tell you exactly. The first sample results for the level was 1,400. The second sample results and the 2,000 milligram per kilogram.
And what's considered like
the initial screening level is 400 for homes. For commercial industrial is 1,400. So if a level of 1,400 based on the hours, 40 hours a week of a regular industrial use, it will be okay. And those are the screening levels. Then the Department of Health does a more sophisticated analysis to determine what are the concerns. So the levels here are not in the 90,000 that I explained. The levels here, the first that we discovered was 1,400. The second set came one with the 2,000. There was another one, let me be accurate, that was qualified at 2,600 or so. So those are the results that we provided to the Department of Health for them to evaluate.
on a scale from 1 to 10, with 1 being safe and 10 being super unsafe, we're pretty low on the scale.
Well, the levels requires further assessment. The levels requires the action that you saw the city to. So no, I get that question quite often. I don't answer from a scale 1 to 10. The levels requires further assessment. The levels require further evaluation by the Department of Health. The Department of Health has not rendered an opinion based on their initial look at the results that were used to close the park.
How soon will that report be coming out about Armbruster Park?
Armbruster, we may know something by Wednesday. We're intending on having a meeting there. Armbruster Park has come back significantly cleaner than
well. I know the city had their consultants and Durham had their. You're going to do half and half.
They take their sample from arsenic. We did it in concert together.
Correct.
And we test at one laboratory.
And they tested in different laboratories, so there's no cross-germinization results.
And there were no heavy metals at Armstrong.
This is the last question, then I'm going to
I have one question. Because we're talking about capping, what effect does it have on the roots of the trees and the plants that might affect us because of the air? Has anybody had thought of that? Because again, trees don't get capped, just the cover, just the ground.
With the mold.
So is there any danger with any of our shrubbery?
What we have done at other sites where we have completed the work, what I can tell you is that cap has been implemented at other parks, still allowing the trees to continue to beautify and provide the landscaping that is needed, properly designed. We just need to make sure, and we have experts for that they still have the amount of water that they need, etc. So we work closely with them. So I expect to see that when the final plan is submitted to have the landscape architects working closely with environmental engineers to develop a comprehensive plan. I have seen it at other sites and we have not seen any detrimental
And the
impact.
other reason I ask that is because our dogs do eat grass and do eat the bushes that are around. So
Right.
that might be something. And what are our side effects? Should we be looking for anything?
Correct. And that please allow us just a tad more time because we do need the Department of Health to conclude evaluation.
The dog's multiplication tables, they start mixing up 2 times 4 and 2 times 8. All right, thank you all very much for coming. You know pretty much what we know.